man or society would consider not to be women of prime age for having children. I know. Like, really? Um, so guess what? The reality is that we exist. Those who are seasoned mamas, those who are seasoned women who have decided to have children later in life, or who were surprised by learning that they are expecting later in life. The reality is that we exist. We are out here. We experience the struggles, have similar concerns, share the excitement of this moment, as well as experience the medical scares that come with pregnancy, particularly late stage or late life pregnancy. So I consider myself to be appropriately transparent. I like to share information about myself, about my experience, and that is with the hope and the belief that it would be helpful in aiding others as they may be experiencing some similar issues. So if you've been following, you've seen that I've been away for several weeks, and I've been away for several weeks because of illness. I am struggling with sciatic nerve pain. I've been vomiting. Yes, at 7.5 months, this is still a thing for me. I have severe carpal tunnel pain, and that's just to name a few. There are some days where laying in bed was all I am able or capable of doing. And so I've given myself that permission to rest. And so I've not been recording, I've not been taking part of these kinds of conversations as I had planned because my body had different plans for me. So to be back, to have some time this evening to spend with you is truly a blessing. So this evening, tonight, I want to talk about advocacy, how to advocate for yourself as a mom to be. I personally have a number of allergies. I have acquired asthma. And prior to getting pregnant, to this pregnancy, I sustained an injury, a torn labrum. And to be honest, it hasn't been able to heal because of the limited available treatment that are afforded to pregnant women because, the things that we aren't able to be exposed to, the things that we aren't able to take or ingest. So when I learned that I was expecting, it was important to me that I was intentional about disclosing my concerns to my providers versus just going through the motions and having people tell me what they would do to me. I don't know if you've ever experienced that. People telling you in the medical world what they will do to you versus inviting you to participate and be an active participant in your own treatment. To be honest, this was not by any means easy. I needed to be heard, but also share my thoughts in such a way that it didn't muddy the waters and that I didn't want my providers to think that I was just being overly paranoid. So with that, what I did was that I shared my prior experience. With my first pregnancy, I had things done to me. And that was with little regard as to what my needs were or what I thought. I was medically compromised. I had weekly medical observation appointments. And even as they took me into the operating room for an emergency C-section, I wasn't even informed about the process, such as that you'd be awake, for example, that your arms would be tied down, as in the case of myself. It was beyond nerve-wracking. Add insult to injury, I experienced an allergic reaction to the numbing medication. And so I was vomiting and choking on my own vomit. And no one knew until my husband looked over and saw tears rolling down my eyes. So to say the least, that experience was beyond nerve-wracking. This time around, wiser, a bit more educated, I decided that I would educate myself and share my concerns and thoughts and express the need to be an active member of this process. So I'm going to share some tips, 7 tips that I would recommend that you consider, that you would take when you are going through this process. So tip number 1, research your potential OBs and their colleagues. Do some digging. Find out from friends, find out from family members, find out from colleagues who they used and what their thoughts were. Research the internet. Look up the bios of the potential individuals that could be your OB and find out if they work as part of a group practice. So if in the event, for example, that you're going into labor and they're not available, do they have partners that they work with to provide you support in the operating room or in the delivery room? So research your potential OBs, their colleagues, see if their training aligns with maybe what you identify as in terms of ethnicity, in terms of beliefs. So are you one who is open to traditional medicine or alternative medicine? Just research your potential OB. So that's tip number 1. Tip number 2, learn what you can about medical advances. We have gone really far. There's been a lot of medical advances in advancements in this area. However, I will say, when it comes to the diabetes test, oh man, there still needs some work to be done. To have to consume that drink, that disgusting drink. I'm like, really? There's, it's been almost 15 years since I had my first child. There's no other changes that have been made, but that's beside the point. What I want you to do is research, learn all that you can about the advancements that have been made and that are available in your area. So, for example, looking at options for home birth, looking at options for maybe the use of a midwife, if that's something that you're interested in, the supportive doula services, especially for those who identify as individuals of color. Research vaginal birth after cesarean. Do whatever research that you are capable of doing. And if you're like, you know what, that's way too much for me, maybe those who care for you, those who have your best interests at heart, can conduct some of that research for you and share some key bits and pieces of information. So that's number 2. Number 3, express your desires, your concerns, and your thoughts at every single appointment. Not one appointment, but every single appointment. Don't be shy. This is your body. This is your future. The little person inside of you growing needs you to advocate for yourself so that they have a better chance in life as well. So it's really important that you advocate for yourself by sharing your concerns, your thoughts, and the desires that you have in terms of medical treatment, going through the process to delivery. Number 4, share with your medical team any medical conditions that you have and encourage them to collaborate with your primary care providers. Physicians, practitioners should not be working in silos. They shouldn't be doing things and functioning as the experts that they are in their specialty area without also consulting and collaborating with other providers that have been taking care of you. So, for example, in my case, I signed releases for them to collaborate with my primary care physician, the doctor who had been seeing me for years, my allergist, my pulmonologist, so that if they're making recommendations for a medication, a treatment, that they're not just looking at what the literature says, what the pharmaceutical companies recommend, but they're taking into consideration me, my unique needs, my medical conditions, and what would be best to help me succeed and help my unborn child. So you want to share with your medical team any medical concerns that you have and encourage that they collaborate with your primary care providers. So that was 4. Number 5, don't just say yes or okay. I was naive and I just rolled with the punches. When they said, well, we're going to do this, okay. We see this, and you need to take that and that. Okay. Whatever you say, doc. Don't just say yes or okay. This is your time to ask questions. What are the potential side effects? What should I be looking for? Is this really necessary given my age? Is this really necessary given my medical history? Would you recommend blah, blah, blah? It is perfectly okay to ask questions. To be honest, you're in the driver's seat. This is your medical health and the health of your unborn child. So don't let this time be the time that you're shy. Ask questions. It's okay to say, I don't know about that, and have your provider really provide some additional education and support to you so that you understand procedures and options. Number 6, meet the members of the OB team. So if you're working with a provider who works as part of a group practice, it is going to be really important that you get to know who the other players are. It is not the best time to sort of play matchmaker, 5-minute dating or speed dating when you are in active labor. And then you find out that you care less for the bed manners of this individual. So it's really important to meet the other members of the team so that they get to know you, that they understand some of your concerns, and that they're not just knowing about you via the reports that they've read, your chart that they've reviewed, but they also get to know you as a person, as an individual, as a patient that they could be potentially providing support in terms of delivery. And then last but not least, let them know, number 7, let them know when you're not doing well. And if you can, document and journal your highs, your lows, and even on the good days. It not only helps you reflect on the process, but in the event that you are experiencing some days where maybe your blood pressure is really high, or you're extremely dizzy, or you're having some upset stomach, bowel issues, and it's not, you're not going to have your next appointment for another 2 weeks or even a month, you may end up forgetting that information, which could potentially be something that really warrants some additional medical intervention. So if you can document when you're not doing well, that's important. And also let them know. Don't keep that a secret. So my hope is that you decide to take all of these tips that I've mentioned into consideration, that you at least reflect on them, that you reflect to see what would be beneficial for you and your baby. And at the end of the day, remember that every single pregnancy is different. You shouldn't be treated like a typical patient, a typical OB patient, because you're not a cookie cutter case. You are unique. Your unborn child is unique. And so although there's a guide that practitioners, OBs use based on their medical experience and training, they also need to look at you as the unique individual that you are and give you the opportunity to play an active role in your treatment. So that is it for me for tonight. I'm wishing you all the best as you continue on your journey. I look forward to seeing you next week and the weeks that follow with the special guests that I will have to join me. And, I am sending you love. I'm sending you positive thoughts and even a warm virtual hug. Thank you again for spending time with me tonight. Again, for today, we talked about pushing through in terms of your medical concerns, and I provided you with 7 tips on how to advocate for yourself. That is researching your potential OBs and their colleagues, learning about the medical advances and treatments available in your area, expressing your desires, your concerns, and your thoughts at every appointment and not be shy. Share with your medical team any medical conditions that you have and encourage them to collaborate with your primary care providers and other specialists that you may have. Not just saying yes and okay and actually asking questions. Meeting members of your OB team. And lastly, let them know when you are not doing well. Again, this was another episode of 40 and Pregnant. I am Tamare Piersaint, Dr. Piersaint. I look forward to you continuing to follow me on this journey and to provide you with additional supports and tips as you navigate advanced maternal, seasoned maternal age pregnancy. Enjoy the rest of the night. I look forward to seeing you next week.